Hey, Alpha Nurses, and this is Andrew from alphanurseguide.com. This is 20 practice questions. Without delay, let's get started.
A 60-year-old comes into the emergency department with crushing substernal chest pain that radiates to the shoulder and left arm. The admitting diagnosis is acute myocardial infarction. Admission prescriptions include oxygen by nasal cannula at 4 liters per minute, complete blood count, a chest radiograph, a 12-lead electrocardiogram, and 2 milligrams of morphine sulfate given IV. The nurse should first 1. Administer the morphine. 2. Obtain a 12-lead ECG. 3. Obtain the blood work. 4. Prescribe the chest radiograph. The correct answer is 1. Administer the morphine. Although obtaining the ECG, chest radiograph, and blood work are all important, the nurse's priority action should be to relieve the crushing chest pain. Therefore, administering morphine sulfate is the priority action. A client has chest pain rated at 8 on a 10-point visual analog scale. The 12-lead electrocardiogram reveals ST elevation in the inferior leads and troponin levels are elevated. What is the highest priority for nursing management of this client at this time? 1. Monitor daily weights and urine output. 2. Permit unrestricted visitation by family and friends. 3. Provide client education on medications and diet. 4. Reduce pain and myocardial oxygen demand. The correct answer is 4. Reduce pain and myocardial oxygen demand. Nursing management for a client with a myocardial infarction should focus on pain management and decreasing myocardial oxygen demand. Fluid status should be closely monitored. Client education should begin once the client is stable and amenable to teaching. Visitation should be based on client comfort and maintaining a calm environment. The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm shown on the electrocardiogram strip below. The nurse identifies this rhythm as 1. Atrial fibrillation. 2. Ventricular tachycardia. 3. Premature ventricular contractions. 4. Sinus tachycardia. The correct answer is 4. Sinus tachycardia. Sinus tachycardia is characterized by normal conduction and a regular rhythm, but with a rate exceeding 100 beats per minute. A P wave precedes each QRS, and the QRS is usually normal. A client with chest pain is prescribed intravenous nitroglycerin. Which assessment is of greatest concern for the nurse initiating the nitroglycerin drip? 1. Serum potassium is 3.5 milliequivalents per liter. 2. Blood pressure is 88/46. 3. ST elevation is present on the electrocardiogram. 4. Heart rate is 61 beats per minute. The correct answer is 2. Blood pressure is 88/46. Nitroglycerin is a vasodilator that will lower blood pressure. The client is having chest pain, and the ST elevation indicates injury to the myocardium, which may benefit from nitroglycerin. The potassium and heart rate are within normal range. An older adult had a myocardial infarction 4 days ago. At 9:30 a.m., the client's blood pressure is 102/64. After reviewing the client's progress notes, see the chart on PDF download, the nurse should first 1. Give a fluid challenge/bolus. 2. Notify the healthcare provider. 3. Assist the client to walk. 4. Administer Lasix as prescribed. The correct answer is 2. Notify the healthcare provider. All of the 12 p.m. assessments are signs of decreased cardiac output and can be an ominous sign in a client who has recently experienced an MI. The nurse should notify the healthcare provider of these changes. Cardiac output and blood pressure may continue to fall to dangerous levels, which can induce further coronary ischemia and extension of the infarct. While the client is currently hypotensive, giving a fluid challenge bolus can precipitate increased workload on a damaged heart and extend the myocardial infarction. Exercise or walking for this client will increase both the heart rate and stroke volume, both of which will increase cardiac output, but the increased cardiac output will increase oxygen needs, especially in the heart muscle, and can induce further coronary ischemia and extension of the infarct. The client is hypotensive. Although the client has decreased urinary output, this is the body's response to a decreasing cardiac output and it is not appropriate to administer Lasix. Which of the following is an expected outcome for a client on the second day of hospitalization after a myocardial infarction? The client: 1. Continues to have severe chest pain. 2. Can identify risk factors for MI. 3. Participates in a cardiac rehabilitation walking program. 4. Can perform personal self-care activities without pain. The correct answer is 4. Can perform personal self-care activities without pain. By day 2 of hospitalization after an MI, clients are expected to be able to perform personal care without chest pain. Severe chest pain should not be present on day 2 after an MI. Day 2 of hospitalization may be too soon for clients to be able to identify risk factors for MI or to begin a walking program. However, the client may be sitting up in a chair as part of the cardiac rehabilitation program. The nurse is caring for a client diagnosed with an anterior myocardial infarction 2 days ago. Upon assessment, the nurse identifies a systolic murmur at the apex. The nurse should first: 1. Assess for changes in vital signs. 2. Draw an arterial blood gas. 3. Evaluate heart sounds with the client leaning forward. 4. Obtain a 12-lead electrocardiogram. The correct answer is 1. Assess for changes in vital signs. Infarction of the papillary muscles is a potential complication of an MI causing ineffective closure of the mitral valve during systole. Mitral regurgitation results when the left ventricle contracts and blood flows backward into the left atrium, which is heard at the fifth intercostal space, left midclavicular line. The murmur worsens during expiration and in the supine or left side position. Vital sign changes will reflect the severity of the sudden drop in cardiac output, decrease in blood pressure, increase in heart rate, and increase in respirations. A 12-lead ECG views the electrical activity of the heart, and echocardiogram views valve function. When administering a thrombolytic drug to the client who is experiencing a myocardial infarction and who has premature ventricular contractions, the expected outcome of the drug is to 1. Promote hydration. 2. Dissolve clots. 3. Prevent kidney failure. 4. Treat dysrhythmias. The correct answer is 2. Dissolve clots. Thrombolytic drugs are administered within the first 6 hours after onset of an MI to dissolve clots and reduce the extent of myocardial damage. A client with acute chest pain is receiving IV morphine sulfate. Which of the following results are intended effects of morphine? Select all that apply. 1. Reduces myocardial oxygen consumption. 2. Promotes reduction in respiratory rate. 3. Prevents ventricular remodeling. 4. Reduces blood pressure and heart rate. 5. Reduces anxiety and fear. The correct answers are 1. Reduces myocardial oxygen consumption. 4. Reduces blood pressure and heart rate. And 5. Reduces anxiety and fear. Morphine sulfate acts as an analgesic and sedative. It also reduces myocardial oxygen consumption, blood pressure, and heart rate. Morphine also reduces anxiety and fear due to its sedative effects and by slowing the heart rate. It can depress respirations. However, such an effect may lead to hypoxia, which should be avoided in the treatment of chest pain. Angiotensin-converting enzyme inhibitor drugs, not morphine, may help to prevent ventricular remodeling. The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm on the monitor. See the electrocardiogram strip below. The nurse should 1. Notify the physician. 2. Call the rapid response team. 3. Assess the client for changes in the rhythm. 4. Administer lidocaine as prescribed. The correct answer is 3. Assess the client for changes in the rhythm. The client is experiencing a single PVC. PVCs are characterized by a QRS of longer than 0.12 second and by a wide, notched, or slurred QRS complex. There is no P wave related to the QRS complex, and the T wave is usually inverted. PVCs are potentially serious and can lead to ventricular fibrillation or cardiac arrest when they occur more than 6 to 10 in an hour in clients with myocardial infarction. The nurse should continue to monitor the client and note if the PVCs are increasing. It is not necessary to notify the physician or call the rapid response team at this point. Lidocaine is not indicated from the data on this ECG. A client is receiving an IV infusion of heparin sodium at 1,200 units per hour. The dilution is 25,000 units per 500 milliliters. How many milliliters per hour will this client receive? The correct answer is 24 milliliters per hour. To solve this problem, first, calculate how many units are in each milliliter of the medication. The questions gives us 25,000 units per 500 milliliters. 25,000 units divided by 500 equals to 50 units. 500 milliliters divided by 500 equals to 1 milliliter. So it's 50 units per 1 milliliter. Next, calculate how many milliliters the client receives per hour. Since the client is receiving 1,200 units per hour and there is 50 units per 1 milliliter, we divide 1,200 by 50, which equals to 24. So the client is receiving 24 milliliter per hour. A client admitted for a myocardial infarction develops cardiogenic shock. An arterial line is inserted. Which of the following prescriptions from the healthcare provider should the nurse verify before implementing? 1. Call for urine output less than 30 milliliters per hour for 2 consecutive hours. 2. Metoprolol 5 milligrams IV push. 3. Prepare for a pulmonary artery catheter insertion. 4. Titrate dobutamine to keep systolic BP greater than 100. The correct answer is 2. Metoprolol 5 milligrams IV push. Metoprolol is indicated in the treatment of hemodynamically stable clients with an acute MI to reduce cardiovascular mortality. Cardiogenic shock causes severe hemodynamic instability, and a beta blocker will further depress myocardial contractility. The metoprolol should be discontinued. The decrease in cardiac output will impair perfusion to the kidneys. Cardiac output, hemodynamic measurements, and appropriate interventions can be determined with a PA catheter. Dobutamine will improve contractility and increase the cardiac output that is depressed in cardiogenic shock. An older adult has chest pain and shortness of breath. The healthcare provider prescribes nitroglycerin tablets. What should the nurse instruct the client to do? 1. Put the tablet under the tongue until it is absorbed. 2. Swallow the tablet with 120 milliliter of water. 3. Chew the tablet until it is dissolved. 4. Place the tablet between the cheek and gums until it disappears. The correct answer is 1. Put the tablet under the tongue until it is absorbed. The client is having symptoms of a myocardial infarction. The first action is to prevent platelet formation and block prostaglandin synthesis. The client should place the tablet under the tongue and wait until it is absorbed. Nitroglycerin tablets are not effective if chewed, swallowed, or placed between the cheek and gums. The nurse is monitoring a client admitted with a myocardial infarction who is at risk for cardiogenic shock. The nurse should report which of the following changes on the client's chart to the physician? 1. Urine output. 2. Heart rate. 3. Blood pressure. 4. Respiratory rate. The correct answer is 1. Urine output. Oliguria occurs during cardiogenic shock because there is reduced blood flow to the kidneys. Typical signs of cardiogenic shock include low blood pressure, rapid and weak pulse, decreased urine output, and signs of diminished blood flow to the brain, such as confusion and restlessness. Cardiogenic shock is a serious complication of MI, with a mortality rate approaching 90%. Fever is not a typical sign of cardiogenic shock. The other changes in vital signs on the client's chart are not as significant as the decreased urinary output. The nurse has completed an assessment of a client with a decreased cardiac output. Which findings should receive the highest priority? 1. BP 110/62, atrial fibrillation with heart rate 82, bibasilar crackles. 2. Confusion, urine output 15 milliliter over the last 2 hours, orthopnea. 3. Oxygen saturation 92% on 2 liters via nasal cannula, respirations 20, 1 plus edema of lower extremities. 4. Weight gain of 1 kilogram in 3 days, BP 130/80, mild dyspnea with exercise. The correct answer is 2. Confusion, urine output 15 milliliter over the last 2 hours, orthopnea. A low urine output and confusion are signs of decreased tissue perfusion. Orthopnea is a sign of left-sided heart failure. Crackles, edema, and weight gain should be monitored closely, but the levels are not as high a priority. With atrial fibrillation, there is a loss of atrial kick, but the blood pressure and heart rate are stable. The physician prescribes continuous IV nitroglycerin infusion for the client with myocardial infarction. The nurse should 1. Obtain an infusion pump for the medication. 2. Take the blood pressure every 4 hours. 3. Monitor urine output hourly. 4. Obtain serum potassium levels daily. The correct answer is 1. Obtain an infusion pump for the medication. IV nitroglycerin infusion requires an infusion pump for precise control of the medication. Blood pressure monitoring would be done with a continuous system and more frequently than every 4 hours. Hourly urine outputs are not always required. Obtaining serum potassium levels is not associated with nitroglycerin infusion. The nurse notices that a client's heart rate decreases from 63 to 50 beats per minute on the monitor. The nurse should first 1. Administer atropine 0.5 milligrams IV push. 2. Auscultate for abnormal heart sounds. 3. Prepare for transcutaneous pacing. 4. Take the client's blood pressure. The correct answer is 4. Take the client's blood pressure. The nurse should first assess the client's tolerance to the drop in heart rate by checking the blood pressure and level of consciousness and determine if atropine is needed. If the client is symptomatic, atropine and transcutaneous pacing are interventions for symptomatic bradycardia. Once the client is stable, further physical assessments can be done. The client is admitted to the telemetry unit due to chest pain. The client has polysubstance abuse, and the nurse assesses that the client is anxious and irritable and has moist skin. The nurse should do the following in which order from first to last. 1. Obtain a history of which drugs the client has used recently. 2. Administer the prescribed dose of morphine. 3. Position electrodes on the chest. 4. Take vital signs. The correct order is 3. Position electrodes on the chest. 4. Take vital signs. 2. Administer the prescribed dose of morphine. And 1. Obtain a history of which drugs the client has used recently. The nurse should first connect the client to the monitor by attaching the electrodes. Electrocardiography can be used to identify myocardial ischemia and infarction, rhythm and conduction disturbances, chamber enlargement, electrolyte imbalances, and the effects of drugs on the client's heart. The nurse next obtains vital signs to establish a baseline. Next, the nurse should administer the morphine. Morphine is the drug of choice in relieving myocardial infarction pain. It may cause a transient decrease in blood pressure. When the client is stable, the nurse can obtain a history of the client's drug use. A client is admitted with a myocardial infarction and atrial fibrillation. While auscultating the heart, the nurse notes an irregular heart rate and hears an extra heart sound at the apex after the S2 that remains constant throughout the respiratory cycle. The nurse should document these findings as 1. Heart rate irregular with S3. 2. Heart rate irregular with S4. 3. Heart rate irregular with aortic regurgitation. 4. Heart rate irregular with mitral stenosis. The correct answer is 1. Heart rate irregular with S3. An S3 heart sound occurs early in diastole as the mitral and tricuspid valves open and blood rushes into the ventricles. To distinguish an S3 from a physiologic S2 split, a split S2 occurs during inspiration, and S3 remains constant during the respiratory cycle. Its pitch is softer and best heard with the bell at the apex, and it is one of the first clinical findings in left ventricular failure. An S4 is heard in late diastole when atrial contraction pumps volume into a stiff, non-compliant ventricle. An S4 is not heard in a client with atrial fibrillation because there is no atrial contraction. Murmurs are sounds created by turbulent blood flow through an incompetent or stenotic valve. While caring for a client who has sustained a myocardial infarction, the nurse notes 8 premature ventricular contractions in 1 minute on the cardiac monitor. The client is receiving an IV infusion of 5% dextrose in water and oxygen at 2 liters per minute. The nurse's first course of action should be to 1. Increase the IV infusion rate. 2. Notify the physician promptly. 3. Increase the oxygen concentration. 4. Administer a prescribed analgesic. The correct answer is 2. Notify the physician promptly. PVCs are often a precursor of life-threatening arrhythmias, including ventricular tachycardia and ventricular fibrillation. An occasional PVC is not considered dangerous, but if PVCs occur at a rate greater than 5 or 6 per minute in the post-MI client, the physician should be notified immediately. More than 6 PVCs per minute is considered serious and usually calls for decreasing ventricular irritability by administering medications such as lidocaine hydrochloride. Increasing the IV infusion rate would not decrease the number of PVCs. Increasing the oxygen concentration should not be the nurse's first course of action. Rather, the nurse should notify the physician promptly. Administering a prescribed analgesic would not decrease ventricular irritability.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.